My name is Dr. Lewis. I'm a psychiatrist at anxiety.pw. This anxiety clinic is one of the biggest online psychiatric clinics in the United States. Let's talk about neurofeedback therapy for anxiety treatment. Neurofeedback therapy is a type of biofeedback therapy that involves real-time monitoring of brain activity and providing feedback to individuals in order to help them learn to regulate their brain functions. It has been explored as a potential treatment for various conditions, including anxiety. Here's an overview of how neurofeedback therapy is used for anxiety treatment. Principle: neurofeedback therapy is based on the idea that individuals can learn to control their physiological responses, including brain activity, when they receive real-time feedback about those responses. In the case of anxiety, the goal is to help individuals gain more control over their brain patterns associated with anxious thoughts and feelings. Process: during a neurofeedback session, the individual's brain activity is measured using an electroencephalogram, EEG, or other neuroimaging techniques. The data is then processed and presented to the individual in a way they can perceive, such as visual or auditory cues. For example, they might see a graph or play a video game that responds to their brain activity. Training: the individual is guided to perform mental exercises or engage in relaxation techniques with the aim of achieving a desired brain activity pattern. As they successfully achieve this pattern, they receive positive feedback, such as the game responding favorably or the visual cues indicating improved brain state. Over time, the individual learns to associate certain mental states with the positive feedback. Learning: through repeated sessions, the brain is thought to adapt and learn to self-regulate its activity, eventually leading to a reduction in anxious symptoms. The idea is that as the individual gains more control over their brain patterns, they can better manage anxiety triggers and responses. Individualized approach: neurofeedback therapy is typically tailored to each individual's specific brain activity patterns and needs. The specific brain areas and frequencies targeted for regulation can vary based on the person's symptoms and underlying causes of anxiety. Research and effectiveness: the effectiveness of neurofeedback therapy for anxiety is an area of ongoing research and debate. Some studies have suggested positive outcomes, showing that neurofeedback can lead to reductions in anxiety symptoms. However, the research is not yet extensive enough to consider neurofeedback a widely established and evidence-based treatment for anxiety. Complementary approach: neurofeedback therapy is often used as a complementary or adjunctive therapy, alongside other established treatments for anxiety, such as psychotherapy, medication, and lifestyle changes. It's important for individuals seeking treatment to consult with qualified mental health professionals who can provide a comprehensive approach. For updates on anxiety topics, please subscribe to our channel. To make an appointment, please schedule your appointment on anxiety.pe.